Instrument adjustment versus chiropractic manipulation, gentle precision or the audible release, by Dr. Masoud, Shamaeizadeh, DC. Soft Touch Chiropractic, Porter Ranch and Northridge, California. When patients search for a chiropractor in Porter Ranch, chiropractor in Northridge, or a gentle chiropractic adjustment near me, one of the questions they often ask is, what is the difference between an instrument chiropractic adjustment and traditional chiropractic manipulation? Both techniques are used in chiropractic care to address joint mobility and musculoskeletal problems, but the experience can be quite different. One uses a small, handheld instrument to deliver a quick, controlled impulse to a specific area. The other generally uses the chiropractor's hands to deliver a controlled, manual thrust. Understanding these differences can help you discuss with your chiropractor which technique may be appropriate for your condition, comfort level, age, examination findings, and treatment goals. What is traditional chiropractic manipulation? Traditional chiropractic manipulation, sometimes called a manual chiropractic adjustment, usually involves the chiropractor using the hands to apply a quick, controlled thrust to a joint. The National Center for Complementary and Integrative Health, NCCIH, defines spinal manipulation as a technique in which a practitioner uses the hands or a device to apply a controlled thrust to a spinal joint. Traditional manual manipulation may use a quick, controlled movement, move a restricted joint, stretch surrounding tissues, sometimes produce an audible pop or crack, provide the hands-on adjustment experience some patients prefer. What causes the popping sound during a chiropractic adjustment? Many people associate chiropractic care with the familiar pop or crack. However, the sound itself should not be confused with the goal of treatment. A manual adjustment can sometimes produce an audible release as the joint moves, but a louder sound does not necessarily mean a better adjustment. Likewise, an adjustment that produces little or no sound should not automatically be considered less effective. The objective is not simply to make a joint crack. The chiropractor should consider the patient's joint movement, examination findings, symptoms, health history, comfort, and response to treatment. What is an instrument chiropractic adjustment? An instrument-assisted chiropractic adjustment uses a small, handheld mechanical instrument to deliver a rapid and localized impulse. Instead of using a larger manual movement of the patient's body, the chiropractor can position the instrument directly over a particular treatment area. Importantly, the official NCCIH description of spinal manipulation using the hands or a device recognizes that a controlled thrust may be delivered manually or with a device. Instrument adjustments are often quick, localized, controlled, performed with less overall body movement, performed without significant twisting, performed without requiring an audible popping sound. For this reason, instrument-assisted care may appeal to people specifically searching for a gentle chiropractor in Porter Ranch or Northridge. Precision versus force. Does a stronger adjustment mean a better adjustment? Not necessarily. One common misconception is that the more forceful an adjustment feels, the more effective it must be. Chiropractic treatment is more complex than simply applying force. An adjustment can vary according to force to speed, to direction, to contact point, to patient position, to technique, to treatment objective. Instrument-assisted adjustments emphasize a small, localized mechanical impulse. Traditional manual manipulation generally involves a hands-on controlled thrust. The best approach should not be determined simply by which technique feels stronger. In fact, research examining whether spinal manipulation must be directed at a highly specific vertebral level found that targeting a specific vertebral level did not produce superior pain or disability outcomes compared with non-targeted spinal manipulation for non-specific low back pain. This is another reason chiropractic care should involve more than simply finding a painful area and applying greater force. What does research say about spinal manipulation? Spinal manipulation has been studied extensively, particularly for low back pain. A systematic review and meta-analysis published in JAMA examined spinal manipulative therapy for acute low back pain and found that it was associated with modest improvements in pain and function for people with acute low back pain. The NCCIH review of spinal manipulation for low back pain similarly reports evidence of modest or small improvements in pain and function in some people. This is important because chiropractic care should not be presented as an all-or-nothing treatment. Different patients may respond differently, and chiropractic care should be individualized. Chiropractic care as a non-drug approach. Another reason some patients consider chiropractic care is their interest in conservative, non-drug approaches to musculoskeletal pain. The NCCIH identifies spinal manipulation as one of several non-drug approaches for low back pain. This does not mean chiropractic care replaces every other form of healthcare. Rather, it may be one option within an individualized approach to managing certain musculoskeletal conditions. Who may prefer an instrument chiropractic adjustment? Some patients simply do not like the feeling of being twisted or manually manipulated. Others become tense because they are anticipating the popping sound. An instrument chiropractic adjustment may be worth discussing if you prefer a gentle chiropractic technique, are uncomfortable with significant twisting, become tense during traditional manual adjustments, prefer a localized adjustment, do not like hearing a popping or cracking sound, prefer less overall movement during an adjustment. The patient's medical history and examination findings are also important because certain conditions may require treatment modification or may make particular forms of manipulation inappropriate. Who may prefer traditional chiropractic manipulation? Other patients prefer traditional hands-on chiropractic manipulation. Manual chiropractic adjustment may appeal to patients who prefer hands-on chiropractic care, are comfortable with manual manipulation, like feeling joint movement during treatment, are comfortable with an audible release, have previously responded well to manual chiropractic treatment. Neither preference is automatically right or wrong. The technique should fit the patient, not force the patient to fit the technique. Does an adjustment need to crack to be effective? No. This is one of the most important misconceptions we discuss with patients. The audible release that sometimes accompanies manual manipulation is not, by itself, a measurement of treatment success. An instrument adjustment may produce almost no sound. A manual adjustment may produce a noticeable sound. The sound alone does not tell us whether the treatment was clinically successful. Instrument adjustment versus manual manipulation. Which one is better? There is no single technique that is automatically best for every patient. At Soft Touch Chiropractic, we believe the decision should be individualized. Several factors may be considered. Examination findings plus health history plus age plus previous injuries plus joint mobility plus comfort level plus treatment goals plus response to care. Some patients may prefer primarily gentle instrument chiropractic adjustments. Others may prefer traditional manual chiropractic manipulation. Some patients may benefit from different approaches at different stages of their care.